this is my mother, Kim Tan-Min. 2022, she go normal medical checkup, and then doctor said her head has a little bit problem. At the time, we didn't know anything about this medical terms, so doctor told her she need to take surgeries. In Myanmar, we do not have a MICS. We only have open head surgery. To some hospital, and she looking for this open head surgery, and she make some knowledge about this surgeries. And then she saw Apollo Hospital, and then we met with Dr. Varun.
Ms. Kin Than is a 68-year-old female from Myanmar. I first saw her during an OPD visit to Myanmar, and she came with severe aortic stenosis. She was really worried about getting an open chest surgery, and she opted for MICS. Looking at her, I was indecisive whether she would be a good candidate for MICS or not, because she's 5 feet tall and weighing more than 70 kilograms. We still thought we would give it a chance. When she came to us, we did all the tests. Even in the test, her annulus size was very small.
And then he explained her about this operation, and then she wanted to do right away. And then we made our hospitalization.
We were discussing whether it will be good to go ahead with MICS or not, but because she was very scared of the open surgery, I decided that we'll go ahead, and in case required, there will be 1 to 2% chances of open chest surgery, which was explained to the patient, and they happily agreed to it.
I remember morning 8:30, she went into the operation theater.
During the surgery, we made a small cut on the chest, put in a big valve, but unfortunately, because of the small size of the annulus, her heart could not take that valve. It was an extremely difficult decision for me and the team to change that heart valve. We took it out, we put a valve which suited her body and not go for the larger valve, which would have been great. We accepted very good results rather than going in for great results. So with the valve which we put in the second time, she had very good results, and we came out of the surgery.
And then when I saw my mother, she is not yet awake. She is with the ventilator, and then doctor said this operation was very difficult, but she is stable now.
She stayed in ICU for 1 or 2 days. First day, she was extubated in the morning, but in the evening, when she started to move, she had some bleeding in the chest. I had to control the bleeding going back to the OT.
At this point, decision of doctor is very important. I realize that if doctor going decision is wrong, my mother will be very bad. Dr. Varun told me to come inside the ICU. Operation is finished, and she is now stable. She is good condition. He told me like that. So I ran back to the ICU and I saw her again.
Following that, she did very well. Following this control of the bleeding, within 2 days, she was out of ICU. In step down, she started walking around. And thankfully, because of her will, because of her son's support, and because of their trust in us, she could be discharged on 6th post-operative day.
And then she is very well. No draining outside. She already wake up and she can speak to me. She can listen some this Dhamma sound. She is very well at the time. I thanks God and thanks Dr. Varun very much.